Get Healthy Cincinnati from the Christ Hospital Health Network and these local partners.
My name is Dr. Denise Sutler. I'm a general obstetrician gynecologist with the Christ Hospital. Annual exams in OB-GYN are very important, but the reasons vary depending on the patient's age. The current screening recommendations for pap smears are to start at age 21. However, we encourage women to come in earlier if they're sexually active prior to the age of 21. Following that, we go through annual exams looking for needs in regard to pregnancy planning or birth control. As a woman finishes up her childbearing, we're looking at birth control options moving forward. And then in the 40s and 50s, we're looking at the menopausal and postmenopausal issues. It's very important to have a good relationship with your gynecologist. By nature of what we do, we're dealing with very sensitive topics. We're going to cover those topics in your routine annual exams, and very oftentimes we're dealing with problems on a very personal level that impact you and your family. Routine tests during an annual exam vary with age again. At age 21, we would begin pap smear screening, which is a specific test looking for cervical cancer. We also always do a breast exam yearly with each annual exam, independent of a patient's age. Beyond the age of 30, pap smears can be performed every 2 to 3 years, depending on the patient's history and risk factor. We're also in the younger ages and based again on risk factors, looking for risk for sexually transmitted diseases and testing for those. I think it's important for patients to have focused questions when they come into the gynecologist. Oftentimes they have fears or concerns about their personal or private lives, and they're apprehensive about bringing those forward. It's great to have an open and honest relationship with your gynecologist so that you feel comfortable pursuing those questions. If you're thinking about starting a family or planning for a pregnancy, it's important to see your obstetrician gynecologist for counseling so that you can review your lifestyle risk factors, look at your medication list to see if there are any of those medications that might be contraindicated in a pregnancy. It's also important for you to begin taking a multivitamin every day with folic acid. Folic acid has been shown many times over to decrease the rates of spina bifida or neural tube defects in offspring. Also, as women are more likely to delay childbearing until their mid to late 30s, and even for some women into their 40s, it's a perfect opportunity to sit down with your gynecologist, have an honest conversation about what the risk factors are and what special testing might be indicated based solely on your age.
Brought to you by the Christ Hospital Health Network, 5WLWT, and the Inquirer.